Well, today marks the World AIDS Day. In Uganda, activists remain concerned over the impact that COVID-19 pandemic has on treatment among HIV patients. Uganda has 1.4 million people living with HIV, and 1.3 million of them are on antiretroviral treatment. CGTN's Hilary Ayasega reports.
Immaculate Nshemerirwe is living with HIV, but she says getting HIV-related services during the COVID-19 pandemic has been a challenge.
I've been struggling with the side effects of the drugs. I couldn't get a counselor to explain my experience. Before the pandemic, it was easy to discuss our problems with counselors, but now when you go to the hospital, they just write prescriptions on the bottle and they do not even touch the medical card.
And she's not alone. Teresa Tindicheitira has to walk to the health center. The transport fares have doubled due to the effects of the pandemic restrictions on movement.
By the time I come back home, I am weak. I can't do anything because of joint pain.
Others say taking a balanced diet is a problem because of limited resources.
Some of us lost our jobs, so we can't afford the right diet. But doctors tell us you have to eat well before taking drugs.
Campaigners say equitable access to medicines, vaccines and health technologies remain a big challenge for many patients. Good nutrition and drug management are cornerstones of HIV care. Doctors here worry that the gaps in treatment because of the effects of COVID-19 pandemic can cause drug resistance in HIV patients, which may reverse initial improvements. HIV/AIDS activists have intensified outreach programs to help their members access the services.
We are talking about equitable access to services, and it is done through mobilization, especially grassroots people mobilizing their fellows to go and access treatment wherever possible.
The government says it wants to vaccinate about 22 million people by January next year so that it can fully reopen the economy and also relax restrictions. But for patients like Nshemerirwe, accessing better services may take some time as the government tries to fix the gaps in the health system. Hilary Ayasega, CGTN, Kampala, Uganda.